Hi there. Could you tell us your name and your designation?
Yeah, hello. I am Dr. Parag Khatavkar. I am MD in chest diseases and I am working as a consulting chest physician in the Department of Respiratory Medicine in KM Hospital in Pune.
Okay, so let's dive into the subject of asthma. What is asthma?
Asthma basically is a disease of the respiratory system. And as you know, the respiratory system, to be specific, it's disease of the airways. And as you know, our lungs are responsible for taking in oxygen inside our body and throwing off carbon dioxide. And for this function to happen, the most essential thing is our airways, the status of our airways. If the airways are open, this function occurs smoothly. But if the airways they narrow, then one gets difficulty in breathing. And this is exactly what happens in asthma. The airways they get narrowed, and they get narrowed because they are hypersensitive. By this I mean they are more sensitive to the changes in atmosphere, the various components in the atmosphere. For example, there are trivial changes in the climate. If the patient is exposed to dry climate in the dry season, dry weather, if the patient is exposed to humidity, especially in the rainy season, or they are exposed to dust, house dust mites, the pollen grains, fungal spores, and various other trigger factors which we call. If he gets exposed, their airways are hypersensitive to these trigger factors, and their airways go into contraction. They narrow, and hence the patients feel difficulty in breathing. So, because of the airway narrowing, the patient gets breathless, and this is what happens in asthma.
Right. So I think it's a very commonly asked, frequently asked question that is asthma hereditary?
Yeah, that's a good question. Most of the times, asthma is a hereditary disease. It doesn't mean that with each generation you will get asthma. It may skip the generations. For example, if the great grandfather is having asthma, his son may not be having, but his son may be having asthma. Or all the family members or all the generations may not be having asthma as such, but they may be having some allergic diseases. For example, allergic rhinitis or allergic conjunctivitis or sinusitis or skin allergies or asthma. So it's mostly a genetic disease. So most of the asthma patients are born with genes which are making their airways very sensitive to non-specific triggers in the atmosphere.
Right. Okay. So how does one diagnose asthma?
It's very easy as far as the clinical symptoms and signs are concerned. In asthma, as I told you, that the airways get narrowed, and so there is difficulty in breathing. And while breathing, the patients with asthma they create a sound called as a whistling sound in their chest. At the same time, they have cough. They produce a lot of sputum, which is very difficult to bring out because of the sticky nature of the sputum. So, difficulty in breathing, wheezing sound, and sputum production are the signs of asthma. But these are not continuous, these are episodic. By episodic, I mean in between these episodes of attacks of asthma, patient is absolutely all right. So, whenever the patient gets exposed to these trigger factors which I had enumerated, example the pollen grains, fungal spores, etc., they develop congestion, chest tightness, congestion because of the narrowing of the airways, they develop cough. But this is episodic in nature. It wanes off as the time passes, and in between the periods, he is absolutely all right. So this is one way in which one can diagnose the asthma as far as symptoms and signs are concerned. When you go to the doctor examines you with a stethoscope. He hears the whistling sound. He asks the detailed history, especially about the hereditary nature of the disease. Somebody in your family may be having some asthma or some allergic diseases, and he does some tests on you, which are called as spirometry, which is a part of pulmonary function test, in which you breathe in an instrument, and you are giving your airway function is measured with that spirometry, and then you are given a drug called as a bronchodilator, which dilates the airways. And after 15 minutes of this drug, your function is again assessed with the spirometer, and a change in the function is noted, and that is hallmark of asthma. That diagnoses your asthma.
Right. Well said. Is there any cure to asthma?
Cure. Unfortunately, there is no cure for asthma. Once you are born with asthma, asthma stays with you. But good news is that with modern medicine, there is effective control over the asthma. And with effective control, I mean if you are taking the medications properly under the supervision of a doctor, then and regularly, then your asthma symptoms will not trouble you. and you will live as if you are not having asthma. The main thing is that you should be taking your drugs, you should be taking your medications regularly under the supervision of the doctor.
Right. Now, in the current times that we are living in currently, commonly asked question is that is one more susceptible to COVID if one has asthma?
As far as susceptibility is concerned, it is the same as that of the general population. But if you get COVID, asthma patients, they get COVID, the COVID may be, the severity of the COVID may be more as compared to the general population. So you should be very much aware of this, and you should protect yourself from this illness, COVID illness. As you asked me about the treatment of asthma, and I told you about the various things, it should be taken regularly. I would like to add some points that there are two types of medications which are used in asthma. One is called as reliever and the other is called as a preventer. The reliever medications are those which are given during the attacks of asthma. So once you take the reliever medication, immediately within 5 to 10 minutes your symptoms get relieved, you start feeling better. At the same time, if you take the preventers are the drugs or the medications which will prevent the further attacks. So both are equally important. Reliever has to be taken only during the attacks and preventer has to be taken regularly whether or not you are having trouble. This is very important, because we have seen the patients taking the medications, they start feeling better and they stop the medications and then they land up into trouble. So even if you are not having any symptoms, you have to take the medications regularly under the supervision of the doctor. Now, these medications mostly they are given by inhaled route. So inhaled route with the help of the inhalers. These are the devices with which there are two types of inhalers, dry powder inhaler and the wet powder or the metered dose inhalers. So with these inhalers, the drug is targeted directly to the lungs. So they are delivered directly to the site where they have to work. So the dose which is required, the medicine dose which is required is very, very less. It's in micrograms. So there are less side effects of these inhalers. There are a lot of myths about these inhalers, that whether these inhalers are addictive in nature. It's not an addiction. It's just like you are brushing daily in the morning and the evening. So it's not an addiction. It's a good habit. For asthma patients, taking inhaler is a good habit. It is not an addictive process. So the bottom line is we have to take these medications regularly, whether or not you are having trouble. Let the doctor decide when to reduce the dosage. Let the doctor decide when to stop the medications. Patient should not decide just because they are feeling better. At the same time, there are other medications in the form of oral tablets, intravenous medications, especially steroids and other things. But these intravenous medications are mostly reserved for those patients whose severity of asthma is more, and usually they are given in the hospital settings.
Thank you very much, Doctor.
Yeah, welcome.